Hello everyone, welcome to Simsad Aesthetics. I am a professional esthetician and cosmetologist. Today, I am going to break down a complete guide about vitiligo disease, its risks, benefits, latest best research treatments and more. So watch complete video to get best advice. Subscribe my channel to get latest updates. Section 1. What is vitiligo? Vitiligo is a chronic skin disorder characterized by the loss of pigmentation, leading to white patches on the skin. This condition occurs when melanocytes, the cells responsible for producing melanin, the pigment that gives skin its color, are destroyed or stop functioning. Vitiligo affects people of all skin types but is more noticeable in individuals with darker skin tones. The exact cause of vitiligo remains unclear, but research suggests it is an autoimmune disorder where the body's immune system mistakenly attacks its own melanocytes. Other contributing factors may include genetic predisposition, oxidative stress, and environmental triggers. Section 2. Types of vitiligo. Vitiligo is classified into different types based on the pattern and distribution of white patches. The most common form is non-segmental vitiligo, generalized vitiligo, where depigmented patches appear symmetrically on both sides of the body, often progressing slowly over time. In contrast, segmental vitiligo affects only one side or a specific body part, spreading more quickly but usually stabilizing sooner than the generalized type. For those with focal vitiligo, the condition remains limited to a few small areas without widespread progression. The rarest and most extensive form is universal vitiligo, where nearly the entire body loses pigmentation. Another distinct type is mucosal vitiligo, which specifically impacts mucous membranes, such as inside the mouth or genital regions. Understanding these variations helps in determining the best treatment approach and predicting disease progression. Section 3. Causes and risk factors of vitiligo. While the exact cause is unknown, several factors contribute to vitiligo. Autoimmune response, the immune system attacks melanocytes. Vitiligo often coexists with other autoimmune conditions like thyroid disease, type 1 diabetes, and alopecia areata. Genetic factors also play a significant role. About 30% of vitiligo patients have a family history of the condition. Certain genes linked to immune regulation and melanocyte function increase susceptibility. Another key factor is oxidative stress, where an imbalance between free radicals and antioxidants damages melanocytes. Studies show that people with vitiligo often have higher levels of oxidative stress in their skin. Environmental triggers can worsen or initiate vitiligo. These include severe sunburn, exposure to industrial chemicals like phenols, and emotional or physical stress. Some researchers also propose a neurogenic theory, suggesting that nerve endings in the skin may release toxic substances that harm melanocytes, particularly in segmental vitiligo, which follows nerve pathways. Section 4. Latest researched invasive and non-invasive treatments for vitiligo. Beside various topical medications and oral treatments, which can reduce inflammation and help restore skin color, vitiligo treatment has few proved invasive and non-invasive aesthetic treatments too, which are offered by professional estheticians, offering new hope for repigmentation and disease control. Category of phototherapy, light therapy. In phototherapy, I will tell you the 3 most beneficial treatments researched and practical reviews based. Number 1. Narrowband UVB therapy remains the gold standard, stimulating melanocyte activity with minimal side effects. Sessions are done 2 to 3 times weekly for months. Number 2. Excimer laser. It delivers targeted UVB light to small patches, speeding up repigmentation, and with fewer sessions than traditional phototherapy. Number 3. PUVA therapy, Psoralen plus UVA. It is less common now due to higher side effects, nausea, sun sensitivity, but may still be used in stubborn cases. Category of surgical treatments. Number 1. Skin grafting. Transfers healthy skin to depigmented areas, best for stable, non-spreading vitiligo. Number 2. Melanocyte transplantation. Extracts and cultures a patient's melanocytes, then transplants them into white patches, highly effective but costly. Number 3. Micropigmentation, tattooing. It is a cosmetic fix for stable vitiligo, matching skin tone with medical-grade pigments. Combination therapies, like JAK inhibitors plus UVB, currently offer the fastest, most reliable results. Always consult a dermatologist and esthetician to tailor treatment to your vitiligo type and progression. Section 5. Cost analysis. Topical treatments can cost somewhere from $20 to $60 per tube to $1,500 to $2,500 per month. Phototherapy, light therapy, can cost somewhere from $50 to $150 per session of narrowband UVB, to $200 to $500 per session of excimer laser or PUVB therapy. Surgical treatments can cost somewhere from $2,000 to $5,000 per session of skin grafting, to $300 to $1,500 per session for micropigmentation, tattooing. Section 6. Dermatologists Reviews. According to Dr. Pearl Grimes, Vitiligo and Pigmentation Institute, corticosteroids work best in early-stage vitiligo but must be used cautiously to avoid skin thinning. According to Dr. Amit Pandya, UT Southwestern, narrowband UVB remains the gold standard, safe, effective, and works well in combination with topicals. Section 7. Psychological impact and coping strategies. 1. Counseling and support groups. Professional therapy can help manage the emotional toll of vitiligo. Cognitive behavioral therapy, CBT, is particularly useful in addressing negative thought patterns. 2. Cosmetic camouflage. For those who prefer to conceal patches, specialized makeup and self-tanners can blend depigmented areas with the surrounding skin. Section 8. Frequently asked questions, FAQs, from Google Trends. Question 1. Can vitiligo be cured permanently? Fact. As of now, there is no permanent cure for vitiligo. However, medical treatments like topical creams, light therapy, and JAK inhibitors can help restore lost pigmentation and prevent further spread. Question 2. Does stress cause vitiligo? While stress doesn't directly cause vitiligo, it can trigger or worsen the condition in some people. Stress affects the immune system, which may accelerate the destruction of melanocytes. Question 3. Is sun exposure good or bad for vitiligo? Moderate sun exposure can be beneficial because UV rays stimulate melanocyte activity, aiding repigmentation. However, excessive sun exposure can lead to sunburn, especially on depigmented skin, which lacks natural protection. Always use sunscreen on unaffected areas and limit sun exposure to safe levels. Question 4. Can vitiligo spread to others? No, vitiligo is not contagious. It is an autoimmune disorder, not an infection, so it cannot be transmitted through touch, blood, or any other form of contact. Question 5. What's the best treatment for fast repigmentation? Currently, combination therapies, such as JAK inhibitors, like Opzelura, paired with UVB phototherapy, show the fastest and most effective results in clinical studies. These treatments work by suppressing the immune attack on melanocytes while stimulating pigment production. For localized patches, excimer laser therapy may also speed up repigmentation. Final verdict. While vitiligo remains a challenging condition, medical advancements provide effective ways to manage it. Early treatment, stress management, and sun protection play key roles in improving outcomes. If you have vitiligo, consult a professional esthetician or dermatologist to explore the best options for your skin. Stay informed, stay hopeful, and remember, vitiligo does not define you. If you like this video, like and share this video. Don't forget to subscribe.